Jesse, you're on.
Good evening and welcome to this virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. I'm your mayor, Jesse Adeguin. I'm pleased to be joined tonight by leaders in our city's COVID response, Dr. Lisa Hernandez, the City of Berkeley Public Health Officer, Dr. Lisa Varhus, the Director of the Health, Housing, Community Services Department, and our City Manager, Dee Williams-Ridley. And it's been a month since our last town hall, and we know that so much has happened. California announced that everyone ages 16 years and older will be available for vaccines by April 15th. And expanded eligibility launched last week, and the city is working to make more appointments available. So all individuals who wish to get vaccinated, and we encourage everyone to get vaccinated, ages 16 and older can get access to vaccine. We also encourage you to go to myturn.ca.gov to also sign up for appointments there as well. Case rates are continuing to climb in Berkeley and in Alameda County, as well as hospitalizations. The governor announced a week or so ago that the state will end its tiered reopening blueprint by June 15th, allowing all businesses to reopen with masking and other requirements. Alameda County and Berkeley has entered the orange tier, enabling more business activity to commence. And soon we'll find out whether we're entering the yellow tier. And we know that students are returning to the classrooms after many months of being away from their classrooms, their teachers, and their fellow students. With students returning to our elementary schools 5 days a week and some on-campus instruction for middle and high school students. So our city leaders will provide updates on case rates, the city's response to COVID-19. But I just want to take this opportunity before I turn over to Dr. Hernandez to recognize the work of our city staff and our community partners in expanding eligibility and access to vaccines for people of color and other communities disproportionately impacted by COVID-19. Some of you may have read a few weeks ago on Berkeley side about a unique partnership that Berkeley was able to establish with the Ebenezer Baptist Church in South Berkeley, where we had a vaccine clinic at the church site. And this is one of several equity points of distribution that we have established at various locations throughout the city, including with Berkeley Youth Alternatives, Mount Zion Church, the Multicultural Institute, and we are certainly seeking additional community partners. In addition, a volunteer outreach team has knocked on doors in South and West Berkeley to sign up residents for vaccine appointments with particular focus on multilingual populations. And we seek to continue to expand partnerships with churches and other community organizations. We know that people with the greatest means and access to technology can more easily sign up for vaccine appointments. But essential workers, people that are working constantly, working in our grocery stores, our bus drivers, and other essential workers helping keep our economy going, individuals experiencing homelessness, seniors, and other impacted communities, often those who have been most disproportionately impacted by COVID-19 and had the highest rates of contracting COVID, have had difficulty accessing vaccine appointments. So this is part of the city's efforts to address the significant issues of equity and vaccine access and to ensure the health and safety of our entire community. I want to thank our public health staff and our community partners in Carbon Health for working with us to expand access to these life-saving vaccines. Our community is making significant progress in controlling the spread of COVID-19, and we need to continue our diligent efforts. So thank you to our staff, and thank you most specifically to the Berkeley community, who over the past year has really risen to the occasion and really prioritized the health of our entire community. We are making progress. There's light at the end of the tunnel, and let's keep going. So with that, I want to turn it over to Dr. Lisa Hernandez, our City of Berkeley Health Officer, to provide us an update on case rates, shelter-in-place orders, and any other information you'd like to share with the Berkeley community tonight. Dr. Hernandez.
Good evening. It's almost hard to say good evening when it's so sunny and beautiful outside, but good evening. I will start with the case numbers for Alameda County and then excuse me, I'm sorry. Of course, a tickle in my throat happened exactly when I have to present. So I will talk about Alameda County numbers, and then I will focus specifically on City of Berkeley cases and hospitalizations, and then provide an update, as you mentioned, Mr. Mayor, on vaccinations and how we are doing with our tier status. So for Alameda County, we now have, and this is not including City of Berkeley, cases, 81,837 confirmed cases of COVID-19 and 69 individuals hospitalized, with 20 individuals currently in the intensive care unit. Those two numbers, a hospitalization number and ICU, do include City of Berkeley residents, and those numbers are much lower than we've seen them in months past and reports past, which is excellent news. In terms of total deaths for City of Alameda County residents, we're now at 1,436 individuals who have passed away due to COVID-19 in Alameda County. Every week, the state calculates the indicators, both case rate and test positivity, which are used for our tier status, and they're released on Tuesday. So I have last Tuesday's numbers, and we will get the numbers for our tier status tomorrow. But I will let you know that we'll still remain in the orange tier. So for case rate reported last week for Alameda County, we're at 4.7 cases per 100,000 per day. That's our unadjusted rate, and our adjusted case rate is at 3.1 cases per 100,000 per day, and our test positivity is at 1.2%. And again, that places us in the orange tier. City of Berkeley cases, we now have 3,520 confirmed cases of COVID-19. We're averaging about 3 cases per day. Hospitalizations total have had about 127 individuals hospitalized due to COVID-19. We have only 1 individual currently hospitalized, which is good news. I'd like 0 people hospitalized, but we're definitely doing much better than we have in past. Total deaths for City of Berkeley residents that have succumbed to COVID-19 are 41. Total tests reported on City of Berkeley residents are now at 326,569, and we're averaging about 728 tests per day, and our percent positive is at 1.2%. That's our cumulative test percent positive since the beginning of the pandemic, and we're also trending down with that number, which is excellent. We calculate our own case rate and our test positivity. They're not calculated at the city level jurisdiction, but we do that ourselves, and we calculate it every week, just like the state does. And our case rate last week was 3.84 cases per 100,000 per day, and that's an unadjusted case rate. And our test positivity is at 0.28%. So these are good numbers. And if we were calculating it as a county jurisdiction and had a tier status, we'd be in the orange tier as well. For vaccination numbers, we've had over 100,000 vaccine doses administered to City of Berkeley residents. We're actually at 104,688 doses administered to City of Berkeley residents, and that translates to 41,563 individuals who are fully vaccinated, who are over the age of 16. And that's about 39% of our population being fully vaccinated. So that is excellent. I think we were at like 16% when I reported last month. So we're definitely doing well. And as you mentioned, Mr. Mayor, access has increased and eligibility has expanded. Before I talk more about vaccines and our tier, I do want to talk about the outbreak at Berkeley High School, because that is something that was reported recently in the news. and was reported to us last week. So there is a COVID-19 outbreak at Berkeley High School affiliated with the boys basketball tryouts that occurred last week. We currently have 3 cases identified with those tryouts and about 45 individuals exposed. We know that those that are cases are isolating, and those that have been exposed are quarantining, and we are continuing to perform the investigation. And we do anticipate more cases because this was a large exposure and large outbreak. That said, we are working closely with the superintendent, the high school itself, the athletic directors, and we have paused all upcoming tryouts. This week was another week for tryouts for some of the sports. We are pausing on those tryouts. However, other sports that are already competing are allowed to compete. I want to remind people that sports has been ongoing in Berkeley High for since the summer, actually, and definitely during the school year, and we have not had an outbreak. So we want to make sure that people know that while this is definitely an outbreak and we're working with the school for this incident, that other school sports have occurred and they have been safe. So I just wanted to note that and reassure parents and individuals in the community that this is one thing that we know we're working on, but that there has been sports that have occurred without any outbreaks. So let's move on to the blueprint update. As Mayor mentioned, we are in the orange tier. We were eligible to move into the less restrictive tier this week, just because we have to sit at the orange tier for at least 3 weeks before we move to a less restrictive tier. We will not be moving to the yellow tier this week. We're basically seeing a slight increase or leveling off of the cases, both in the city and the county level. So we will continue to sit at this orange tier for a bit longer. What we know is that there's substantial activity that has already been allowed to open up. And last week, we were able to expand some activities with relaxation of some of the restrictions, specifically for private gatherings, indoor live events with assigned seating, and other private events such as receptions and meetings and conferences. And there was additional guidance that was released by the state that provides expanded capacity for those settings, especially in light of having either proof of vaccination or proof of a negative test. So we know that while we do remain in the orange tier, we will see the ability to have additional activities occur because of some of the relaxations that occurred last week. That said, I want to make sure that individuals know that we are still in a pandemic. We still have disease circulating, and while we are seeing increasing vaccination rates, which is excellent news, it does not mean that we let our guard down, that we still continue to wear our face coverings. We still physically distance, especially in public settings. We wash our hands, we stay home when we're sick, because those safeguards continue to keep us safe and disease transmission low. The other thing I want to talk about in terms of the blueprint, as the mayor mentioned as well, the governor announced the transition out of the blueprint and tier status for mid-June. I am hopeful for that to occur. It's 2 months away, but it is definitely a bright light at the end of the tunnel. But it is contingent on sufficient vaccine supply and low disease burden. What I do anticipate for when that occurs, hopefully as anticipated in mid-June, is that we will continue to have face covering mandates and general risk reduction guidance, such as frequent hand washing and staying home when you're sick. The other thing just to remember, even as we go through these tiers, that the regulations for Cal-OSHA, which is the body that regulates work sites and industries, still remain, and they may be a little different than the public health guidance. So workplaces must adhere to the Cal-OSHA guidance. As we know, on April 13th, the CDC and FDA recommended a temporary pause on the Johnson & Johnson, otherwise known as Janssen vaccine, out of an abundance of caution. And this was due to the fact that there were 6 reported cases of a rare but severe type of blood clot that occurred in 6 individuals. And this was 6 individuals that experienced this health condition out of nearly 7 million doses administered. So while this was a significant health condition, is a significant health condition, I want to note that it was essentially 1 in a million individuals had this condition. That said, the Advisory Committee on Immunization Practices, which is part of the CDC, paused and made that recommendation. The state paused, the city paused on Janssen vaccine. We are waiting to get additional guidance from the Advisory Committee on Immunization Practices, otherwise called ACIP. They met last week, and they did not make a definite conclusion. They said there was not enough data to draw conclusions about additional risk, specifically about gender or race. However, I do anticipate they are expected to meet the end of this week, and I do anticipate them providing specific guidance for this vaccine. So I do believe we will be able to use the Janssen vaccine again. It just will be either with specific restrictions based on age or gender, and or restrictions about or guidance in regards to how to manage someone who presents with certain symptoms. So we will see on that, but I do want to say that a couple things. People are worried, if they got Janssen vaccine, what should they do? If you received the Janssen vaccine more than 2 weeks ago, 3 weeks ago, then you should not worry. Because what we are seeing as individuals became symptomatic 6 to 13 days after receiving the vaccine. So if it's been over 2 weeks since you received the vaccine, you should not be worried. If you have received the vaccine more recently and developed severe headache, abdominal pain, leg pain, or shortness of breath, then you should contact your healthcare provider or seek medical care immediately. So I would say those are the guidance. If you still happen to have a vaccine appointment with the Janssen vaccine, and my mom was one of those individuals, actually, you need to reach out to your healthcare provider and reschedule. We do not want individuals to wait for the Janssen vaccine to get vaccinated, because we want people to get vaccinated with the first available vaccine. And in that case, we do have both Moderna and Pfizer vaccine that is still available and is still safe to use. That said, as mentioned by the mayor, we have increased availability for eligibility for vaccine for those 16 and older, and we continue to offer vaccination clinics with both the Moderna and Pfizer vaccine. And again, as soon as you are able to get a vaccination appointment, please go ahead and get vaccinated. It is one of the strongest tools that we have right now to help us get back closer to normal. I will stop there and hand the microphone, the virtual microphone, back to you, Mayor, and I'm ready to answer questions when it's time.
Thank you so very much. Before we go to the city manager, Dr. Barhus, was there anything you wanted to add to Dr. Hernandez's comments?
No, I just really want, given the article that was published in Berkeley Side, underscore the commitment of the city to work collaboratively with the school district. We really are impressed that they have been able to run so many sports competitions over the last few months. And, errors happen and things happen, but generally speaking, they have been very collaborative, very responsive, and we continue to work together with them so that we can keep schools that are open.
Thank you so much. Madam City Manager, I want to turn it over to you to provide an update on city operations and any other information you'd like to share with the Berkeley community tonight.
Thank you, Mr. Mayor. I would like to capitalize on 3 things and just kind of limit my discussion to some of the priorities that our city is underway with right now. I know most of our community is aware, but over the next few months, we will be engaging in our budget process. It will be probably around a 4-month process from April to July and end of June anyway. And we are going to be looking very strategically at all of our revenues, addressing the American Rescue Plan Act and how we can utilize and capitalize those funds. This will particularly be in line to make sure that we can continue our operations and ensure that our city's community needs are met. The city is expected to receive a total of $68 million. We'll receive those funds in 2 installments, and we'll be asked to certify and provide reports that the use of those stimulus funds align with the legislation and guidance that will be provided by the Treasury Department. So those guidelines have not been issued yet, but we do envision that once those are released to jurisdictions, we'll be able to ascertain what our responsibilities will be around those. This budget process is critical. As you know, our community and our business community are, just our families have all been suffering through this pandemic. And so we realize that this will be a critical recovery for us all. And we'll be looking at those resources to make sure that our city revenues can cover those operations that are dire to our community. Also, I am certain that our community is aware that our chief of police is no longer, Chief Andy Greenwood retired about 3.5 weeks ago. I want to assure our community that this will be a robust community process, just involving a host of community engagement approaches that will allow the community to weigh in different aspects of the process, including interviews, selecting a recruitment firm to do a national recruitment for our city, maybe even town halls and things that will allow input on what our community is looking for in the next chief of police for the Berkeley community. So I want to make sure that our community is aware that that will be a very important process to me as the city manager, as well as our council, as we decide along with our community input on our next chief of police. Currently, we do have an interim police chief in place. Her name is Jen Lewis, and she is doing a fabulous job at this time as our interim chief. And I invite the community to reach out to her in the department and ask questions and submit interest in what's going on with our police department. The reimagining process is another major priority for our community at this time. That process is well underway. We have a consultant and a task force appointed by our mayor and council members. That process will certainly involve tremendous community outreach and engagement. They're at the very early stages. Our community can accept as a first step a community survey that will be coming out to the community over the next few weeks. And we encourage all of you to participate in that survey when it starts. It will not be the only opportunity for our community to engage, but it will be the first step of widespread engagement. So I do encourage folks to be a part of that. In terms of outreach services during the pandemic, we continue to provide services to our homeless community and our unhoused individuals. We are also underway with, I'm trying to overtalk the background in my home, but we are also engaged in our homeless outreach activities that will culminate into a new shelter that we're looking at in the city. The council will be addressing the ask for me as the city manager to put in place a new shelter and contract so that we can house up to 50 homeless or unhoused individuals in our community. That work will probably end. It started now, but we will probably end and launch that program in early June, late May. So we're looking forward to that advancing. The last piece that I'd like to just kind of share is that our city facilities have been closed since March of last year. And I've assembled a reopening team to start discussions around what will be needed to maintain a safe working environment for our employees as we talk about returning back to work and opening up city facilities. Our guidance so far is to make sure that our plan includes a safe approach for people to work together. It also is going to allow us to be creative in how we return back to work. As you know, over 600 of our employees were teleworking effectively for over a year. Those employees, most of them will be returning to work, but we anticipate continuing a telework environment here in the city of Berkeley and uplifting all of our processes that allow for online and engagement without in-person engagement as much as possible. But we certainly want to provide engagement for our community members that do intend and like to come in to city facilities. So thank you all for being patient with us as we've gone through this pandemic. We're still in it. You're doing an amazing job as a community in making sure that we're safe. And the ladies and the mayor on this call, they are doing a tremendous job in making sure that our community is safe. So I appreciate the time, Mr. Mayor, and I'll turn it back over to you.
Thank you so very much, Madam City Manager. So we're going to turn to your questions and receive several questions from Berkeley residents on a wide range of topics around our COVID response. And I want to address these first, looks like 4 questions to the city manager as they relate to operational issues. The first, and it's a common question, is around commissions. The individual who submitted this question is apparently a city commissioner, and they believe that it's important as we are returning to a new normal that commission operations should be reopened, particularly those vital to public health, public safety, and transportation. And this commissioner would like to help the city in its effort as they transition, and is curious as to whether there are any additional plans to reopen commissions anytime soon so individuals can continue this important work.
Thank you, Mr. Mayor. So as you know, we've been working very hard as a staff to figure out which commissions within our city can reopen fully and return back to full operation, regularly occurring meetings. We've been successful in especially all of our quasi-judicial commissions that are certainly have been open and running since COVID in March, and we were able to make sure that those commissions continued critical business processes for the city. As we move forward, we've also looked at critical processes for other entities such as transportation, parks. Our panel of experts for homeless will be meeting as well. But we are still in a pandemic, and some of the very specific commissions that that would like to meet but do not have explicit agendas in terms of critical resources or issues that need to be addressed at this time, they are on hold until we can have staff deployed to assist. Now, that does not mean we don't want to meet with folks or have our commissions meet. We value the work of our commissions and we appreciate the efforts by all of our commissioners. But at this time, a number of our staff are still deployed in our EOC, still working on the front lines to address the pandemic. And those commissions particularly are within public health, mental health. Those commissions will continue to be difficult to be resourced because we just are deployed in terms of addressing the pandemic and staff have been reassigned. So we will make progress and continue to make progress, and more commissions will come online over time. But we've gone from a massive testing deployment to now a massive testing and vaccination deployment. And that's huge for our city. And I'm really proud of the work that the staff are doing, and we're doing our best to address the needs of the pandemic, while also addressing the needs, operational needs of the city and our commissions. So those commissions that need to meet are meeting. Those commissions that are unable to meet will meet at a time and date in the future, but we cannot staff them at this time. But I do just want to appreciate the fact that they want to be working on some of the major issues and challenges facing our city. But please do not give up. We will be reaching out to you all as soon as we can redeploy our staff to address those needs. So thank you very much.
Thank you so very much. Okay, the next question is around housing assistance. And I think this question is really around assistance for low-income homeowners. We have many ordinances, and we actually have a housing retention program that's specifically focused on helping residential tenants who have had a significant loss of income due to COVID-19 and need need sort of emergency economic assistance, or are facing eviction and need assistance in order to help cover their rental costs. But this resident, who's a 34-year resident of Berkeley, is wondering if there are any programs assisting low-income and first-time homeowner families in Berkeley.
So, Mr. Mayor, to my understanding, I don't have anything to report on that. I don't know if Dr. Varhus from our HHCS department has any additional information, but the programs that you shared are the actual programs that we have available during this pandemic. And I don't have any other programs to share that our city provides at this time. Dr. Varhus, anything that I'm missing?
No, we don't currently at this time. You're correct.
Thank you.
So, I know we have, loan programs we work in partnership with some nonprofit agencies to help fund, improvements to low-income homeowners' homes so that they don't fall into disrepair and, people can, stay housed. But I think this question does illustrate an area where the city can certainly do more, and appreciate the question from the Berkeley resident. There's a question around summer programs. What is being offered or contemplated for summer programs in our schools and parks? And what public safety protocols will be in place?
Thank you, Mr. Mayor. In terms of our schools, I'll just share with you, we have a variety of summer programs that are still available. The health order just expanded our cohorts from 14 to 20. That means that we will have 2 employees for every 20 youth in a separate cohort. And this will give us an additional 200 to 225 summer camp spots. The same protocols and screening, the verbal wellness checks, a temperature check, mask wearing, non-participants not allowed in the playground areas, regular hand sanitizing, camp supplies, sanitized at the end of each day. Those protocols will remain in effect. And those are the things that we have done for the after school program, and those will be in place as we continue. All of the programs will be run in what we call a 3-3. That's a three-week increment. So it'll be a total of 9 weeks. And we have openings in for our all-day camps in Berkeley Day Camp, Sports Camp, our tennis camp, our skate camp, our summer fun camps, and playground programs. So that's the update that I have on that for you at this time. Thank you.
Okay, thank you very much. There was a question around the University of California and whether they'll be allowing foreign students, or what are their plans for summer programs. And that's a good question. I don't know if you know what the university is doing around summer instruction.
So Dr. Hernandez looks like she was raising her hand, and I think she may be able to answer that question really well for us. So I will defer to you, Dr. Hernandez.
I had the same exact question. Thank you for asking that question. I spoke with UC Berkeley this past week about their plans for the summer session. And essentially, their summer session will be mostly online. They will not have, for the undergraduate programs that they normally have that would be on campus, which invites students from not only domestically, but internationally, will be online. The only programs that they will have in person will be more focused for graduate students. And there's a smaller number of offerings for those students. And it will be limited as well. But those individuals will be, but those programs will be, the in-person will be focused just on graduate student programs and under 90 classes and a smaller footprint even that exists right now on campus in terms of students.
And I can also add to that, that we are also working with UC Berkeley around our vaccination campaign. They do have some resources and are vaccinating some people, but we will be, given the risks posed by being a large university city, we will definitely be keeping an eye on our epidemiological data and really ramping up as we expect to receive increased vaccine allocations, especially in the months of May and June. That will really be a place where we'll be able to implement and ensure an eventual safe reopening of UC Berkeley.
Thank you so very much. Now I want to turn to Dr. Hernandez for some public health related questions. The first is around indoor dining and asking if the city, quote, feels good about seeing people dining indoors at local restaurants. And this question notes that when restrictions were lifted previously, we saw case rates increase. Really, it also seems like it's more of a comment rather than a question, but I guess is asking, around the safety of dining indoors. And I know that is not, it's not at 100% capacity. There are limitations about how much indoor dining is allowed.
Yeah, so I think it's, I think what the person is highlighting is the two risky behaviors of being indoors and also being indoors with your face coverings off. Those are definitely behaviors that increase your chances for transmission. That said, we're in a different place than we were back in the winter and fall, even with the fact that we are having increased vaccination. And our numbers are even though we're not in yellow tier yet, we are seeing our case rates either stabilize or decrease. That said, I think it's a choice. Every person has the choice to make to go to indoors. If they go to a setting and they see that they don't feel comfortable, they can leave. I've done that. And that is the reality right now. One is that some people are doing better jobs than others in terms of physically distancing and wearing their face coverings. And when we have people abiding by those restrictions and those and behaving in a more protective way, we're in a safer place. I will say that I have been in the only individual with a face covering on, and either have chosen to leave or have asked people to physically distance or to wear their face coverings. So that said, it's again, it's going to be your choice. I do think that we will see a safer society as we get more and more individuals vaccinated.
Thank you so very much. A question I've been getting is around when, and I don't think we have an answer yet, when the state or the city of Berkeley will, end the face covering requirement. This person said, given the limited evidence of outdoor transmission, the rise of local vaccinations, when will we be able to stop wearing masks outdoors in Berkeley? I understand that they may be required for indoor public spaces, but wondering about broader outdoor use.
My feeling is, well, first of all, the city of Berkeley or no other health jurisdiction can be less restrictive than the state. So if the state has the face covering mandate for indoors and outdoors, then we must abide by that as well. My sense right now is that we will continue to have the face covering guidance for both indoor and outdoor settings, even after the tiers status. We move beyond the tier status, the blueprint status in June. That might change if we see that we have reached a certain threshold for vaccination rates, but I'm not sure if we'll meet those rates. And I don't even know what that magic number is that the governor is thinking to use to relax some of the masking orders outdoors. So at this point, I'm thinking we will continue to have that restriction even beyond June. But I think one of the thresholds will be a certain vaccination rate, and also that our disease transmission rates stay stable.
Thank you very much. There was a very specific question from looks like a small business owner. I'm a local small business owner and a restaurant/brewery. I want to know about seating and partitions. While the progression on tiers is helpful since it's allows more indoor capacity, the real limiting factor for most restaurants is the 6-foot rule. Will tables be allowed to be less than 6 feet apart, or partitions separating tables be a solution in their intermediate? This has an enormous effect on the amount of revenue restaurants can generate, but we want to do so safely. Thanks. I don't know if you have any thoughts, Dr. Hernandez, on that question.
Well, I do want to thank the person who wrote this question about highlighting safety first. That's really important. I think that really allows people to feel reassured when they go into a restaurant or any other setting. At this point, the barriers, whether they be partitions, like actual physical partitions or plants or any other of the other partitions that have been used, that does not allow for a reduction in the 6-foot distance. As mentioned earlier, taking off your face covering, especially eating indoors, is one of the higher risk situations. So at this point, there isn't a change, and the state hasn't made that allowed that to be a reduction. We can't reduce the distance because with the partitions at this point.
Thank you so much. You addressed this next question around entering the yellow tier, that we're anticipating data most likely tomorrow, but that it does not appear that Alameda County will be entering the yellow tier yet. So I think the way it works is based on 3 weeks of data, right? Usually that the state evaluates to determine whether we move to a new tier status.
Well, we have to sit at a tier for at least 3 weeks, which is what we would meet tomorrow. And we have to meet at least a week's worth of a lower tier status, and we have not met that. At this point, we're still firmly within orange tier status for our case rate. And just looking at the data, it looks like we're pretty much stable and sitting at about 3.1 cases per 100,000 per day, which keeps us within the orange tier status. So at least for another week, I think week by week we'll see, and hopefully we will be able to see a reduction. But at this point, we won't be moving in into the yellow tier this week.
I know that, being our own local public health jurisdiction, we make our own decisions, but as far as the state's concerned, they look at it countywide. But even if we just looked at our data, we would still be in orange.
That I can't say that because we calculate our case rate, but we are only able to calculate our unadjusted case rate, and using the unadjusted case rate, we are in the orange tier. If we are able to adjust our case rate, which is what is being used to calculate tier status, we may be in the yellow tier. In the yellow tier, but we do not have that. We don't have the formula that the state is using for that, and it's a bigger decision that the state is wanting the jurisdictions to move as on the county level as opposed to city jurisdiction. So that's the same thing that happens with Pasadena and Long Beach, which are the other two city jurisdictions within the state. And it's understandable. It would be a little wacky to be in the yellow tier on one side of the street, and then on the orange tier, just right over that invisible border that changes us from Alameda County to City of Berkeley. So I think that's one of the reasons why they do it at the county level, because it's a bigger geographic area.
And if you think about it, like, we're a city that we have a lot of flow between both Alameda and Contra Costa counties between us. Like, we can't just look at this from a position of our residents. We also have to look at from the position of people who work in Berkeley, because there are so many that live outside of Berkeley. So, while it could be fun to do the exercise and say, yeah, we would be yellow, it wouldn't make sense from a disease containment standpoint.
Thank you. Question: if a person has already contracted COVID-19, is a flu shot necessary? That's a good question. I mean, my reaction is yes, but flu shot is always a good decision. We were concerned, I think, at the beginning of the year, the December, January, about the sort of twin-demic and the flu season and COVID, and it just resulting in very serious health complications for people. But Dr. Hen, is anything else you'd like to add on that question?
Absolutely. So you're right, Mr. Mayor. You should get both vaccines. They're two different viruses, and definitely want to be protected from both, because having both illnesses, which could be possible, definitely would severely impact your health status. That said, we did do well this year with flu season. A lot of the reason was because people were wearing face coverings, and also because we were sheltering in place. I do worry about next flu season, because if we're out and about as we are now, we know that there's going to be more ability for flu to be transmitted. So I do want to say that people should get vaccinated. The flu vaccine is probably still available in your provider's office. And then when the flu vaccine gets released in August, that's when we usually start seeing it. People should start getting that vaccine. I do want to just make sure that if the other question could be, if I've had COVID already, do I need to get the COVID vaccine? And the answer to that question is yes, you need to get vaccinated as well. Some people have been advised to just wait a little bit before getting the vaccine. The only restriction is that you have to be out of isolation from your infection before getting the vaccine. But otherwise, we know that there are different mutations, different variants circulating, and we know that these vaccines do a really good job protecting individuals from the most predominant variants that are circulating in California and definitely throughout the United States. So the answer for both vaccines, whether you're grappling whether to get the flu vaccine or the COVID vaccine after having COVID, the answer is yes, get them both.
Thank you very much. Okay, there's a question of which variants do we need to be concerned about in Berkeley?
So we are tracking the different variants that are circulating globally, which includes the Brazilian variant, the UK variant, the South African variant, and then also another variant of concern, which is the Western variant, which is really the California variant. And that's actually the variant that we're seeing the most of, besides the original virus, is the California variant. And what we are seeing with that variant in California is that it may be a little bit more contagious, but it doesn't cause you to have more severe disease. And it is covered by the vaccine. So that's the variant that we're seeing. The second most common variant that we're seeing in California, and we've had a couple of cases in Berkeley and about 39 in Alameda County to date, is the UK variant, the B.1.1.7 variant. That one seems to also be a bit more contagious and may cause more severe disease and increased hospitalization. And that one also is very well covered by the vaccine. So those are the two variants that we're seeing. We're actually seeing, as I said, more of the California/Western variant, and we're not sure if that's why we're not seeing more of the UK variant here in California or not. But right now, those are the two big variants that we're seeing: the California variant and the UK variant, a smaller level of that throughout the state and in our county and city, both of which are protected by, you're protected against them with the vaccine. So those are the ones we need to be worried about, but there's strong protection with the vaccine from those. So that's another reason to get vaccinated as soon as possible.
Thank you so much. Lastly, there's a question about whether there have been any outbreaks amongst the campus population recently that you can address. Did the spring break bring back a surge of cases in Berkeley? Because we know that, some people chose to travel to Florida and other parts of the country where and may not have followed strict public health requirements and may have brought back, COVID variants. We know that travel has been a main sort of form of transmission of these variants. So anything you can update the Berkeley community on about whether we've seen an increase in cases amongst the campus community recently?
I was bracing myself for that post spring break surge, both on campus and off campus, like we experienced after the winter break. And fortunately, we did not have a big surge. We did see some cases. I won't say that there were 0 cases associated with the university, but we did not see anything like we saw in January, in particular with a big outbreak both on campus and associated with the Greek houses. So that is excellent news. We are seeing some cases at the university, but nothing like we saw post the winter break.
Thank you so very much. I'm going to take these last 3 questions. And the first question is, I'm assuming this individual is a grocery worker because their hazard pay legislation applies to grocery workers. My job has decided to take away all raises for employees due to the $15 an hour hazard pay. Why has City of Berkeley chosen not to pay employees out of a city payroll rather than force employers to pay? Well, the hazard pay ordinance is in effect for 120 days from the adoption of the legislation. It is unfortunate that your employers chose to take away pay raises as opposed to paying you hazard pay and a raise if it is warranted. For those employees that have not had a pay increase, the $5 hazard pay provides a needed increase in compensation for people working in grocery stores where employees are constantly in direct contact with people. And the reason the council adopted this legislation is in recognition of the public health risk that grocery store employees face and their role as essential workers. There was another question around how the city can help reopen our middle and high schools full time. Teachers are vaccinated after a terrific effort by the city. BUSD and BFT seem to be at an impasse due to the severe detriment of many teens and their families. Please help. I'm going to kind of take a swing at this, and if Dr. Vargas wants to add anything, as she's been most directly involved in, working with BUSD, please chime in. But as far as the city and the state is concerned, BUSD is able to reopen fully now, and we have been working closely with BUSD to support their efforts to reopen. The BUSD recently announced that they will return to full instruction for all grades in the fall. And have allowed 5-day on-campus instruction for elementary school students, some instruction on campus for middle school students, and some on-campus activities for high school students. And I just want to clarify, we do not have any direct authority over BUSD's decisions about when and how to reopen. And a lot of it is also subject to collective bargaining with affected labor groups. It is the city's position that all students should go back to the classroom as soon as possible when it is safe for students and staff. And we're going to continue to assist BUSD in its efforts to plan for reopening. I know, Dr. Vargas, anything else you'd like to add as you are most directly involved in the conversations with the school district?
No, that was very well stated, Mayor. Thank you.
Okay, thank you. And then lastly, there was a question, what is the city planning on doing to assist tenants who might lose their housing once the eviction moratorium lifts and all the back rent is owed? This is a very, very critical question. I just want to first state that my understanding, Madam City Manager, that no decision has been made yet on when the local state of emergency is going to be lifted. The conditions still warrant a state of emergency.
Correct.
But our eviction moratorium for residential and commercial tenants is tied to our local state of emergency. We also know there is state law, which also plays a very critical role in guiding local governments in the implementation of eviction moratoriums. And those jurisdictions that don't have an eviction moratorium, state law does apply. But we're thinking a lot about what will happen after the emergency is lifted. And we know that there are residents who will owe a substantial amount of money to their landlord. Some of whom are making arrangements with their landlords right now to begin to pay that back. The state law already requires that 25% of the rent be paid. So I think going forward, and this is something that we're going to work on and we're going to continue to discuss, we need to expand rental assistance, and some of the money we received from the federal government recently through the American Rescue Plan would be well positioned to consider using that to supplement our housing retention program. The city has a housing retention program, and if you go to the City of Berkeley's website, cityofberkeley.info/COVID-19, there's a whole page with information about resources for tenants, including how to access emergency rental assistance from the housing retention program. You are eligible for up to $10,000 per individual. If you are eligible for emergency rental assistance, and we put millions of dollars into this fund since the pandemic started, but we know that there's a lot more people that need help, and we know that there's a lot more that we have to do. Advocacy with the state, I think, is going to be really critical. Their eviction moratorium expires in July. So what's going to happen after that? And what's going to happen to the millions of people in California who may be on the verge of homelessness? So our role in advocating for the continuation of those rules and the creation of a program to address the the debt that is owed to tenants and property owners is important. I will note that recent legislation did create a fund where landlords who choose to participate and agree not to evict their tenants will be eligible for some funding to help address rent debt. And we need to look at how we address this broader issue of rent debt and it needs to be not just a California solution, but a federal solution. It's part of our whole conversation around, the housing component, the American Jobs Plan. I mean, we need to figure out a solution to how we address this rent debt. So as far as Berkeley's concerned, our eviction moratorium is still in effect. We do have resources, and I'll ask Dr. Vargas to elaborate anything else, but we are mindful of the fact that at some point, this emergency is going to be over, and another very challenging situation is going to kick in, which is how are we going to help tenants and landlords address the back rent that's owed, and to make sure that we don't have more people who end up becoming homeless. But Dr. Vargas, I don't know if there's anything else you'd like to add on that point as your department administers the program.
Yeah, I mean, first of all, I want to thank you, Mayor, because you have been a huge proponent of the housing retention program, and it has literally saved many, many, many households and many, many, many landlords. So it is actually a perfect system where renters don't, come into back rent debt, and landlords actually get their rents paid. And we know that both homeowners and renters have struggled through this pandemic. I also just want to name that the Eviction Defense Center is coordinating. So any new applicants they receive, they are screening them first for eligibility for the state's program. And that way they are significantly leveraging the city dollars that we have put into the program. And I just wanted to really acknowledge the outstanding work that the Eviction Defense Center has done in leading this program. And thank you, Mayor, for your advocacy as well.
Thank you. Thank you for all the work that you and your department, because you have worked really quickly to implement this. We allocated that $1 million and worked really, really quickly to get the additional funds to the nonprofit and work with them to help develop the guidelines and publicize this. So I will do a plug before we sign off. And I'm just trying to pull up the information on the website. If you are a tenant in the city of Berkeley at risk of eviction, including due to inability to pay your rent due to COVID-19, you can contact the Eviction Defense Center at 510-452-4541, 510-452-4541, and leave a message with the following information: your name, your telephone number, and that you are a Berkeley resident seeking assistance, and staff at EDC will follow up to determine your eligibility. So if you do need assistance, please contact EDC at 510-452-4541. So with that, those are all questions for tonight. We will have another town hall in a month and hopefully have more positive news to share with the Berkeley community around our progress in addressing COVID-19. But as Dr. Hernandez said, we are not over yet with COVID. While we are seeing more people out on the streets, going to restaurants, going to bars, people patronizing our businesses, while more people are getting vaccines, it does not mean that COVID is not still out there. And so we have to continue to be vigilant. And I know that we will continue to be vigilant. I'm just really proud of our community and how we've really addressed this pandemic, and proud, obviously, of the city leaders assembled here for all their incredible work. So with that, I want to turn over to Dr. Vargas. Do you have any closing comments for the Berkeley community tonight?
Yeah, I just want to reiterate what you just said, Mayor, and that is this time last year, we were all really, really terrified, and we did not know what was going to happen next or for how many years we were going to be in this situation. The pandemic lives on. We are still very much in it. However, the difference between last year and this year is that last year we were doing everything in our power not to die from COVID. And this year we're really focused on living with COVID, and we will be back. And it's really exciting, and we will get through this.
Thank you. Dr. Hernandez, any closing comments for the Berkeley community tonight?
I'll say similar things. I feel like this is a balancing act, right? As mentioned, where we are able to participate in things that we didn't get to participate and maybe never thought we were going to be able to participate in again. And balance that with also trying to continue to be safe and encouraging those that haven't gotten vaccinated to get vaccinated, and paying attention to what the world will look like with COVID as one of the diseases that will still be living amongst us. So I do think we will have COVID as a disease that we have to be careful and protect ourselves against as we move forward. How that will look, I'm not sure yet. That's one of the things that we're learning day by day. But we do know what's working and what will keep us safe, which are the things that I stress each time. Washing your hands, staying home when you're sick, covering your mouth, either with a face covering, and definitely even I was in the room by myself, and when I was coughing, I covered my mouth, because that's something that we all end up remembering to do. So keeping those behaviors in the forefront, as well as getting vaccinated as soon as we can, are the things that I know the city residents have been very good at doing. And I want to thank the residents for continuing to be good at adhering to the public health guidelines. So I just want to say thank you, and enjoy the lessening of restrictions. And I hope, as you mentioned, Mr. Mayor, that there'll be good news to come in the next time that we meet.
Thank you. Madam City Manager, any closing comments?
Thank you, Mr. Mayor. I just want to echo all of the things that have been said so far, and to thank you for this year of engagement with our community. And I know we have a couple more meetings to go, but I think it has been one of the most positive outlets in allowing our community to hear at hand from two of the most important leaders in guiding this pandemic, Dr. Barhus and Dr. Hernandez. I am just always over the top supportive of these ladies, because the work that they have done has been a direct has shown a direct result on why our community has stayed as safe as we have. So as it gets warmer out there and you want to get out and be a part of all the happenings, please continue to be vigilant and stay safe. We look forward to a couple of more of these town halls with you, Mr. Mayor, in our community. And I just want to thank you all for your commitment. Thank you.
Thank you so much. And hopefully, at some point, we can all have a big block party and celebrate that we're all vaccinated, and obviously do it in a safe way. But we're not there yet. We need to be vigilant. And thank you, Berkeley, for all that you've done. So with that, we will have another town hall in a month. Stay tuned for information about ways to